Do you really struggle every day coming to a mealtime and being like, so I'm hungry, what do I eat? What do I feel like? What's in the house? What do I have the capacity or spoons to make? And it's just a big, overwhelming, frustrating kind of internal conversation, or potentially conversation with someone else in your house or in your household, that maybe might end in tears, maybe might just end in overwhelm, or might just end in not eating. This is really challenging, and as a dietitian who sees people with invisible illness, I have this conversation a lot. I often sympathize and talk about how mentally, physically, emotionally taxing and energy negative a task like this can be. And so although something like forward planning and meal planning can be a really challenging task for those with invisible illness, for those who are neurodivergent, or just for people in general, I find that if we kind of find a middle ground of forward planning that suits the individual person, this can make this situation and scenario 10,000 times easier. Because the way that I like to word it is, if you think about how much time, energy and effort goes into every single day at every single mealtime thinking, what should I eat, and all of those questions that I mentioned before, it probably would add up to a significant amount of time and potentially a significant amount of spoons for a lot of people. So if we hypothetically reduce that time to once or twice a week, we hopefully are making that a lot easier, and hopefully giving you the spoons, the capacity and the mental space to be doing other things that you want to be doing. So this is kind of my first step in like fatigue friendly food or improving food access, is figuring out what's a way with people that we can make forward thinking with food a little bit easier. Now, this is not a one size fits all approach. I find with so many people, I have so many conversations and troubleshoot things depending on their particular life circumstances. And I think that's why it's really valuable to talk through these things with a health professional. But I thought I'd share a couple of tips today that I find generally really helpful in just a bit of a different way to think about forward planning, or the dreaded words of meal planning. Because as a dietitian, I don't often do meal plans, but I set people up to plan their meals and plan how they're going to access food throughout the week so that they are somewhat prepared. But I'm a big believer in realistic, not idealistic planning. So realistically, based on my general flow of my week, based on my general energy levels, based on my routine, or, you know, kids routine or work routine or life routine, you know, what do I need to consider with food? And not just nutrients, like the base level of actually the type of energy and the capacity that I can use on accessing a meal at that time. And so this might look like, you know, planning a couple of days of cooking and a couple of days of leftovers. It could be, you know, having some frozen meals in the freezer for a rainy day, and it's having all of those backup options and knowing what works for you. But essentially what I do is I get people to start by writing or having some sort of list, whether it's just written on a note in their phone, whether it's on a Google Doc, whether it's in any particular apps. Like there are so many recipe collection apps or organization apps that you can use, and just having a list or kind of categories of foods. And this could just be simply broken down into like breakfast ideas, lunch ideas, dinner ideas, and even some snack ideas, because we can't forget about snacks. Or it could be kind of low spoon meals versus medium spoon meals versus high spoon meals. And that kind of relates to capacity. So a low spoon meal would be something really quick and easy to access. It's on those days where you are at your lowest capacity, but you need to feed yourself. And then there are the days for your greatest capacity. What are the other recipes, ideas, and examples that you can access by having a bit more? And that allows you to recognize, well, you know, just with my schedule, it's very common that I probably have at least 1, if not 2, if not 7 low spoon meals a week. I might be in a setback and I might need to plan all of my meals to be low spoon so that I can still access food and consider what that is. But when we are planning, if we just get overwhelmed with all of the ideas, it's too much. If we have things kind of written down and categorized, it makes that sitting down and planning a whole lot easier, because all we need to do is just pick some options. The second thing that I like to do is, yes, plan, but roughly plan. It doesn't have to be on Monday I'm having this, on Tuesday I'm having this, on Wednesday I'm having this. It can, if that suits your lifestyle a bit better, if you like to be more prepared. But if you're someone who likes to go with the flow and have options, it's writing down some different options. And it doesn't have to be 7 different options for the 7 different days of the week. I actually set up a kind of a meal planner that is more day 1 to day 7 instead of Monday to Sunday, because it allows us to just make sure that we have enough options for the week, or it might be for half the week if you're someone who can't think that far in advance and only wants to and can kind of access food or go shopping twice a week, or it might be once a week, it might be for 2 weeks. I've even done that before with patients. And it's just considering and thinking, do I have enough options? You know, where do my leftovers fit? How many meals would this one thing provide me? And allowing that to spread over a couple of days. So then when it gets to a Tuesday lunchtime and you're like, what do I have? You have a whole bingo card of options where you can just cross off what you want. You know you have the ingredients, because I always say we plan and we make an ingredients list out of that when we access our food. So you know that when it gets to Tuesday lunchtime, instead of, oh, what I want and thinking of all of the options, it's what do I want out of this, this, and this. And out of those 3 options or 4 options, this one sounds the best. We know that we have the ingredients, we access it, it fits within our capacity, it fits in with what we need, and we access that particular thing. I think it's also really important to recognize that takeaway and frozen meals and going out for dinner, if that's within your capacity, all of those options are valid within this. And I find that we have much less food waste, much, better outcomes with accessing food and being able to access food in any particular situation if we plan realistically. And that might be having takeaway once a week or twice a week or whatever is, within your capacity at the moment. So those are a couple of tips and the kind of base strategies that I talk about, and they don't suit everyone. And like I said, I definitely talk through this in a whole lot more detail and really troubleshoot that with people in session. And so if you are really struggling with this and these tips were somewhat helpful, but just not enough to help you, please reach out. We have a team of dietitians who are more than happy and willing to help with these things. This is our bread and butter, no pun intended. And we are happy to make food more accessible for you. So comment down below if you found this useful, or if you have any other tips to help with forward planning. It might help someone else out in the comments. And I find that more brains are better than one. So thank you for listening and take care.